Hey lovers, greetings everyone. See what we have here. So I want to briefly talk about leukemia. Alright, so leukemia is the cancer that affects the white blood cell. From our previous teaching, you can check our page. We talked about the blood components where we have the plasma, the white blood cell, platelet, and the red blood cell. So this cancer is affecting the blood, one of the blood components, and the blood component it is affecting is the white blood cell. So we know that the white blood cell is responsible for immunity. So I call it the soldiers of the body. They are responsible for protecting the body against what? Against infection. All right. So anything that causes the white blood cell to be reduced or to be low in the body is going to cause the patient to be prone to infection. So you see them easily catching what? Infection. So what happens in leukemia is that the white blood cell in the bone marrow is not allowed to mature. It releases immature. So those immature white blood cell released are called the blast cells. And then we need to know that it's not just the white blood cell that is affected. These three blood components, the red blood cell, the white blood cell, and the platelet, they are like triplets that cannot be separated. So yes, it's the white blood cell that is having issue here, but then the red blood cells are also released immature, causing this patient to have anemia, and then the platelets are also released immature, causing this patient to have increased risk for what? Bleeding. So when they sustain injury, they are going to really bleed a lot. But emphasis on the blood cells that are released immature. So this is going to cause the patient to have increased risk for what? Infection, like as if they are immunosuppressed and they can easily get infected. All right, I hope you've learned one or two things from here. One of their major treatments is usually stem cell transplant or bone marrow transplant. Okay, I think this is all we have for today, and I will see us again in our next teaching. Bye, and I love you all. Mwah.